Welcome, everybody. I'm Angelica Sadar. We've got a number of board members that I see here from NRBS. Mitchell Sadar, uh, former board member James Cooney. How nice to see
Wow.
you. Dr. Saul Rosenthal. Um, if there's any other board members, please click, chime in for me. I'm going to blast through a number of things. As you know, NRBS is dedicated to offering education for the public and professionals. And why we're here today is one of the resources it offers, which is the sponsor series. And today's presentation is offered by Maya Nich's company, Cedar Psychological and Sports Center. We are looking to future presentations. Next couple in line are going to be with Fred Schaefer, Mike Cohen, and there's more. Um, we're really proud to be active in the community and are going to be offering community meetings starting this summer. The first one's going to be in New York City as part of our effort to provide more connection among practitioners. Our annual conference will be virtual this year, September 26th, 27th. Tom Kalura and Mike Cohen will be some of our presenters. The topic's going to be, what does the future bring? And last but not least, the Healthy Brain, Happy Body podcasts are offered by Dr. Saul Rosenthal, who is also the newly installed president of AAPB. The podcasts are much more enjoyable to listen to in a car ride than the news. Trust me, I'm enjoying them all. Coming up is a podcast series that will include Josh Gondelman, who is a well-known comedian who often incorporates mental health issues in his comedy. And he's going to talk about how these sorts of issues relate to his creative process. You probably have heard him, even if you didn't know the name. He is a regular on the NPR show, Wait, Wait, Don't Tell Me. Okay, today, it is my good luck to introduce my teacher and friend, Dr. Andreas Mueller. He's going to be presenting on From EEG Data to Clinical Insights, an introduction to the HBI Med database and the report generator. As some of you saw, if you came in early, he is constantly inventing things and bringing new things into the field. He brings a background in education, psychology, and research. He's the director of the research clinic in Chur, Switzerland. He's the CEO of the Brain and Trauma Foundation in Switzerland. He's the president of the board of directors of HBI Med and founder of the Brain R clinics in Zurich and Chur. He's credited with the primary data collection for the HBI Med database, for QEEG and ERP analysis. I could go on and on. Let's let him talk, huh? We're delighted that you're here, Andy. Thank you for joining us. I do want to mention, put your questions in the chat, please. We will cull them together so that we don't have redundancy. And as you may have already noticed, Dr. Mueller has a nice accent. And if you're having trouble understanding it, you can go into the More section below on the toolbar in the bottom of the platform. Click on that, and you can do you can have transcripts right below the recording. So take it away, Andy. Thank you.
Thanks, Angelica. Thanks, Mitch. Thanks, everybody who found time to come here to you. It's afternoon to me. It's in the evening at 7. After this meeting, I will have lunch with my wife, and this is also another good event. So I will talk to you today about the newest stuff that we developed. And I can really tell you this is very, very nice stuff that you will listen about, that I will present that with a PowerPoint. This will help me and my accent to that you can understand a little bit better what I can. So I will do it like this one. Just give me a second. Then I have the laser pointer in here, and then we have here another view. Rani, it's okay, everything perfect. Also, you see the title of this talk is Map the Brain Before You Train It. I would say you have to understand the brain before you treat it, and at the end, this is to understand the brain. That's a big word, as you know, and you know this story. Yuri Kropotov always tells it so that there was a rabbi, and the rabbi went this way, and then he was asked by a woman, "What you are doing?" And then he said, "I'm just thinking." And then the woman said to him, "But you know everything that you don't have to think so much." And then he said, "Yeah, I can explain many things, but many things I cannot understand." And this is also so in the brain. There are many things that it's hard to understand what's happened. And for me, this talk is also very important because it makes me thinking, it makes me to try to understand what happens. So actually, we started about 2010 with the development of biomarkers. Maybe you know, our first papers came out on AI on 2010, 2011. And at that time, nobody talked about biomarkers, and even nobody talked about AI. And we have been the first to develop biomarkers on the basis on AI in 2010 on ADHD population. And this was in the beginning very hard because we got a lot of critics from many people, and they could not understand what we are doing here. Fortunately, we had a very gifted guy who worked with us at that time, and he said, we have to try out. And meanwhile, these papers were cited hundreds of times all over the world. And for us, it was a big success to make that. So we have not just a database, and we'll talk about that. So, and for me, in my clinical perspective, I'm always trying to understand what happens. And you see here, we have, and I always had a holistic view of the human, because I'm coming from my first education, of course, was psychology, and then I was a family therapist with a system therapy. So, and then in about just before the 2000, the year of 2000, I discovered that there was a brain. And before, I was like many psychologists and many psychiatricians, they don't know even now that there is a brain, and that the brain has to do something in our daily life. So I made this discovering about 1997, 98, and then I went first to Neurofeedback, and then I met Angelika. That was very good. We met in Mexico, and there we had was a conference, and we were sitting next together. For me, it was very good because my English was already then very bad, and she speaks fluently German, so this was perfect for me. Thanks to that, I'm here now. I can say that. So today in my daily life, I look very often the raw data. Raw data is telling you everything, and I'm always very enthusiastic to see things in the raw data and then to look at that. But of course, and just to tell you, we are looking today on 3 different windows, and then we have state modulators like arousal or vigilance and sensitivity. And these are all concepts that we, in a way, we conceptualized them on the basis of EEG. And we have some biomarkers like indexes of ADHD and emotion regulation. And we have even the subtypes of the networks I will talk to you about. Most important is for today, for you, I know that you know the most of that, what I was talking about EEG. You already know, but maybe you don't know something. And the most important thing is that we have to make a synthesis of understanding, means to make synthesis of many different atoms, and this is something that I will talk to you today, because this is important for treatment. So, and treatment, we do it in everyday strategies. This was for me very important, that human behave themselves on the best strategies for them. We have to talk with them about the best strategies. We have to find out them. Then we can say about medication, which medication is best for them, and also the non-medication therapies, which belongs, of course, to neurofeedback. And we know from many studies that to understand on the basis of EEG and ERPs is very important to have good results in neurofeedback. But not just in neurofeedback, we, for example, discovered a trainings program on education, all on the basis of the EEG and ERPs. Also important is that all the results are measured against the HBI-MED database, and this is so we don't talk about slow frequencies. If we talk about slow frequencies, then we do it talking together the individual result with the HBI-MED database. I can say that I made it, the HBI database. I collected 1,200 people, and you can see here, this is the heart of our method, and these 1,200 people from Switzerland, most are from Switzerland, about 1,100. We have 1,100 healthy people in Switzerland. This is another message that I want to tell you. And it's these people, the database is age specific and gender related. very important. The woman has other girls has other EEG than boys and men. This is very important. If you use other databases, I would first ask to the owner of the database if it's gender related and age specific. Age specific means that we compare the people from ADHD with 8.5 years old with the 50 or 70 next people in this age that we have in the database, and that is probably about 4 or 5 months difference. So you can really think about that if you compare with our database, you compare it with the same gender and the same age people. Most make the 8 to 10 years or 10 to 12 years, but between this age, it's a lot of things going on. So not only you see also the age is from 6 to 89 years old, and we have about 5,000 people that we collected within projects, not from the clinic that we run, the clinics that we have some people together. So these are patients, and we know that we have a lot of different patients, but for example, we have autistic, and we have depressed people, and now we are collecting people with dementia, pre-dementia, so we can then say something about the aging of someone. So, and the difference is always made in Z-scores, and we use in all the indexes, we use the Stanine score. This is from 1 to 9. It's widely used in medicine. And it's important that you know that about the database, and we have this data for eyes open, eyes closed, of course, and then we have it also for different tasks. And the most used task is the VCP. It's a go, no-go task. So just to tell you about that, I want to open the first window. This is the spectra. You know, spectras are used everywhere. It's called QEEG, and it's also important to use it. And but you can see here, we can derive diagnosis from the spectral data? No, and there is also no interventions, only from the spectral data what can be made. We have a neurologist in our praxis in this. She was very skeptical when she came to us, and because she said, "Oh, this, this is like reading the coffee, the coffee, and it says nothing about life." Now she says, because she uses Microstate, she uses earpiece. It's the whole thing shows that what we need to know when we do an analysis. We say it also brain function analysis. So, and you see here 19 electrodes. Of course, you can do it in 32 electrodes. Our database just have 19 electrodes, but we can interpolate to the other electrodes. And Spectral gives you an insight about the self-organization of the brain, and I'm looking always about that. So then we go to the next slide. We have here the ERPs. I don't want to talk more about that. You see here the ERPs. From here to here, you see the picture on the sound. It's a tenth, 1/10 of a second, and then we can just look at the ERPs. You see the red one is the same age, same gender people. And in this case, you see that it's a little bit higher when the sound comes to the beep, pooh, and the neurons have more activation in this case in the beginning, and at the end it is more or less the same. This is just in this case specific, and we know, just to tell you one example, this is the P1, P2, P1N1 component, and this has also to do with the sensory gating, and to people who they hear the sound louder than we have. And then we can also look at this part of the brain or at this part of the brain, and then there are a lot of peaks that are very interesting. I just wrote here some peaks which are important and to so, and we can really say, because there are just a few neurons who makes the sound. So, for example, 600,000 in the brain, 600,000 is just a few neurons. Of course, there are a lot, but at the end, you can see in this case, there is on the sensory gating is much higher than on Simon. You see here that this is significant different from the other people, same age, same gender. And we can really also say something about medication. We can say about neurofeedback. And we don't look just on one method of neurofeedback. For us, all the methods are available. So in some people we prefer to do, if the data indicates, we do frequency training, in other we do ILF, or we do other kinds of training in the praxis. So the third perspective, the third window that we want to open are microstates. The microstates are recently developed, about 20 years, from Professor Ben Lehmann. He worked in Zurich, here in Switzerland, but he and his staff have done a lot of good. For example, Loretta was, all of you know, of course, Loretta. They was also discovered in this institute. And also the microstates theory. So what this theory is saying, that the grand average, we are looking at the grand average of all the electrodes that we have, and we look where the synchronization of the microstates of all the electrodes are the highest, and then they found 5 different states that in all humans occur. Why? Because we are human, and we are doing that all in the same way. Our brain is well regulated in the same states. So, and you see here the different state. It's an auditory, visual, then also the salience and attention network and default mode network. And actually, this microstates are only a few milliseconds that the brain stays in one state and then it goes to the other state, and we calculate at the end the occurrence and the duration, how long is a patient staying in one state. And we have seen that these are very important markers for ADHD and also for autism. The Lempel-Ziff complexity is probably the most important marker, and it tells us if is the brain rigidity or flexibility on this dimension. And we see mostly in autism that the Lempel-Ziff is negative. That means that they have a very rigid way to discover the everyday life, or to use it in everyday life. And this makes totally sense to me, because they do it always in the same way. And by the way, Leslie Pritchett, she was one of the first one in the States. She was the wife of the godfather of EEG, Roy John, and she did it together with this institute of Dan Lehmann. They worked a lot in this institute about microstates. So these are these three windows to the brain, and then we go to the operating conditions. We have seen that to know something about the regulation of the brain in arousal states, if they have very high arousal, if they have low arousal, this makes a difference in the treatment. And this was discovered by me, this arousal formula. Why I did it when I worked on the ADHD project in 2013 to 2017, I talked with about 3,000, I had about 3,000 talks, and with patients who have been in this project. And then I was listening very precise what they are talking to me, and then I looked to the data and I brought that together. So then we found out the formula which is pretty good, and people told me you should get the Nobel Prize for that. Not the Nobel Prize for peace, but the Nobel Prize for medicine. But in psychologists, they have no Nobel Prize, so there is not a discussion about that. Then we discovered the formula for vigilance. Vigilance is an important marker for us, because we see if someone is losing energy during the task, or if he is gaining the energy during the task. And people who can work for a long time on a task, they always recover or recuperate from that what they do. They have an inside possibility to take breaks without that you know that they take breaks. And it seems that this is very important. And then we have another very, very important measure, it's sensitivity. And this is something that we will publish in the next time. Why? Because we discovered that about 30% of the difference is between human, if they are sick, or if they have a handicap, or if they have difficulties, is driven by sensitivity. the sensitivity. And it's, for me, it's very clear, if you get a lot of insight from your sensory system, you have to work more, you have to make more clear, and so on and so on. And these three conditions are very operation conditions. This is very important, and you see the sentence here: spectra is tuning, earpiece are nodes like information, and microstates are phrasing. Arousal, vigilance, and sensitivity decide whether the music is fresh, tired, or overstimulated when they play together. Just to let you know that you can understand me, or is this just bullshit for you? Just to ask. Is it okay? Okay, thanks, Mitch. So we have some indexes which we worked on. ADHD, for example. We did this huge project about ADHD, probably the biggest project that we had in Europe about biomarkers. We tested 500 people from 6-year-old to 50-year-old 5 times during 2 years, because we wanted to see how they developed. And inside this project, we made a ADHD index. Then we had another sample that are depressed people are in, or people with insecurity, anxious people, a lot of emotional driven dysfunctions. So we have an index for them, and then we have the networks, the different networks of the brain, for example, limbic brain, or the arousal singular cortex brain, and the prefrontal brain. And what we see actually, that in ADHD, most of the people have difficulties in, most of the young people, of the children, has difficulties on prefrontal cortex, but in older people, in adults with ADHD, they have more difficulties in the limbic system. It's very interesting, because you cannot treat adults only just with methylphenidates or amphetamine or something like that. Okay, let's go to the next slide. So, and now it becomes interesting. It becomes really interesting, because our difficulties that we have so many different markers that we have about 50 or 60 markers, and how normal brain like me, simple brain like I have, can put it all together. Nobody can understand that. So this was a very important discovering. So what that means, if we have all this, you see, all these things can be different, and many more. We have questionnaires, and we have neuropsych testings, and we have the whole brain stuff. The whole brain stuff alone brings us up about 1,000 different variables. And so how you can understand that, and how you can treat it. So treat these people, how you can give them the best treatment possible. As I have told you, it's not just neurofeedback, it's not just medication, it's always a whole package in our praxis. So what I did is, we started this project about 5 to 7 years ago. when we have been in Costa Rica about 5 years ago. Well, now, when it was when we had COVID, we have been in Costa Rica. So when at that time we started, and I remember discussions with you, Mitch, and with Angelica about that, and we can say that after 5 years we found a way to bring that, to condense all these markers to 4 simple dimensions. And this was like the discovering of the wheel. This was enormous for me to see that we can bring them in 4 dimensions. And of course, I don't discover these dimensions myself, but I have seen the work of the people who made this ERDOC system that you have discovered in the United States from NIH. So I took that system and I look at the system of the precise prediction system. So we can very exact now tell the people on which dimensions they are wrong based on the variables that we have here. And this is really the main questions. It's not to measure more things. The main question is to make the synthesis. And the synthesis is the solution, not to discover more is the solution. The synthesis is the solution. And then we wrote, during 2 years, we wrote the co-pilot. And the co-pilot brings that all together. It brings it together, all these different things that are helpful to know. And you see here we have 4 dimensions. The first dimension that we are looking for insights are the sensitivity system, and also the salience system. You know, salience and sensitivity are very, very important because you need someone who drives your sensitivity, who tells you if is it too much, or is it okay or not. And then you need a control system in your brain that regulates your brain, and then you need the possibility to have the to look at that what happens, and to have a way how to control your emotions. Very important. And the next, the mentalization system dimension is the dimension who brings together you as a person together with your social life. And this is the important. And for me, it was like a big discovering, because I found we can look at these dimensions and the system brings it together, and we can explain it on the basis of this universal system. And that gives me a new possibility also to read exactly that these dimensions, because when people is coming to us, there is just a few things which are deviant, and we have to discover these few things, and then to decide which strategies they need, which neurofeedback protocol they need, which medication they need, that goes directly and precise to these dimensions which are deviant. So this is the most important what I want to tell you. We have a lot of possibilities to discover thousands of variables, but we need to bring it together because we need to understand. And to understand, make things, to understand a few things, make things simple, and to bring together this huge differentiation to, in a vertical way, to some few dimensions that makes me as a clinician happy, because then I can understand much better the patients that I treat. And this is my goal. So what we can say, we have atoms and we know these rules, then we know the rules that we try to understand what it is. Sometimes we can only explain, we don't understand, but we try to explain, and it gives a synthesis. And what is the good thing, that we don't have to discover everything alone. We have about 40 million or 50 million papers in PubMed and in other databases of the literature, and which we can use. Important, very important, because so the whole community of science comes together in each thing, in each person, in each patient. And you think this is very complex. No, it isn't. Before we did courses, we did the best courses that you can imagine. But after the 1 week of courses, people have not been able to do a report, and to think about that. And now, after the first day that we do, we talk with them about the system that I just talked to. Each one. There is not one that can not do the report himself on the same level as I do it. And I studied about 25 or 26 years now, all this stuff. Okay, this is what I wanted to talk to you. It would come here. There are some cases. Let's go on. And then we have the treatments, multimodal system of everyday strategies, medications, and therapies, and very important to all of us. And we just found, and we discovered a new neurofeedback that we can show what changed in the brain during these insights of neurofeedback, that we make neurofeedback with them. And we saw that vigilance is one of the most important what changes, and arousal is one of the most important. Of course, we have there is a lot of in a report. It's an 80-page report. Nobody can read it. Some are doing that, and they still see something. But it's the synthesis. It's the synthesis for you, that you can see this is sensory system, this is regulation system, this is emotional system, or this is the mentalization system. And once you know that this simple system, you can drive your praxis in a huge day. You will have work for the next 7 generations that are working in your praxis, because we have so many people that come to us that they say, finally someone who understands us and who can tell us what it is. It's in our words, and it's the good way to do it. Okay. Thanks. I hope you could understand and you can explain what it is. It's the synthesis. This is the most important stuff.
Yes, and I just first of all, thank you. That was very, very good, Andy. I enjoyed it. It was short, it was concise, but it conveys as well as anyone could just what you have been able to accomplish. But I want to make sure that our colleagues in the US, when we hear the word diagnosis, we right away think about a DSM, and I want the people listening to know that's not what Anthony's talking about. He is
Yeah.
talking about the biomarkers, the synthesis, bringing us to a realization, to an understanding, and it's that that we're calling the diagnosis. It's a more general term, and I want to make sure that there is not there isn't confusion here. This is not about DSM diagnosis.
Yeah, no, we need it. We need the DSM diagnosis also, ICD-10. We need it for the insurances, and we need it probably for some people who wants to know if they have ADHD or not. But it says the diagnosis don't say anything about treatment. And we know also that a lot of diagnoses are simply wrong because they are just made on a few questionnaires and one or two questionnaires. And we can say that most of the questionnaires are just a simple spectrum. But we need DSM for diagnosis. This is important. But what I'm talking about is the understanding of the processes. The inner circles of the human are most important, and this has nothing to do with, or not nothing, but has only little to do with the diagnosis. It's the understanding of the processes of that what helps, and that what is important for the people to know what it is. And this is also that what people tells me every day. Tomorrow I have, I think, I guess 4, 5 talks with patients about the results. People tell me, hey, this is really helpful. Nobody could tell me that on this level. You could do it now. And it's the understanding, and people feel much better to understand on this level than on the level of diagnosis. DSM is important. It's made. It's a reality. But to understand is the most important thing. Good. Angel wanted to show something.
Yeah, so I will send out following. You'll all get emails as a follow-up. You'll get a link to the recording on YouTube. Um, and with that, I'm going to have a whole flow chart of how this works. It's a little bit overwhelming at the beginning, but once you look at the flow chart, it makes a lot more sense. Um, and you certainly can reach, those of you in the US or outside. So happy to have everybody here today from all over the place. You can certainly reach us and we'll try our best. I put in the way to reach HBI Med in the chat. Um, So that's available to you also. Um,
Yeah,
go ahead,
Andrew.
Vicky.
I just wanted
Well,
to say, this is not a question, this is just a comment. I just wanted to say congrats, Andy, on streamlining this in this way. I used the HPI reports from a couple of years ago, and I recognize that it's a real challenge to take all the different kinds of data that we're working with and all these different atoms and all these different neuromarkers, resting state data, the different ERP components, and then the different sort of algorithmic measurements you have of arousal, these different things that are using machine learning, et cetera. So I applaud you for taking that and then trying to tackle this problem of actually synthesizing meaning from it in a way that is based on actual robust data and that works alongside with the clinician, and what you're speaking to as far as like the sense of validation and relief that clients or patients feel when they actually hear what's going on in the brain, I think is something that a lot of us clinicians want to be able to do. And like we connect with the data, we connect with the client, we help them see what's going on with their brain. So I appreciate all that you've done to help make this more accessible for both the clinician and the person sitting in the seat, because it is a learning process, and I'm excited to check it out.
Very good.
thanks, Nick.
It's a
And
good summary.
Michael Pierce asked if it will illustrate the toxic effects upon the brain networks as well as the indicators of a detox and correction in metabolic brain pathways. And if I first may answer this in a general way, and then Andy, what Andy's been able to do is a lot, but two general things. First, all of these ways to measure and to analyze, the vigilance, the ERP components, the spectra, the algorithms, bang, 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 bang. But then with the Copilot, it searches the literature and it looks for the combination of this particular patient's situation and whether that is about metabolic effects or residual trauma or whatever may be. So it's really quite a phenomenal. So that's the general answer. But and Andy specifically, would your analysis and the co-pilot kind of be able to look at toxic effects the brain is experiencing?
Yeah, good question. So behind that, what the Copilot is doing, there are about 1,000 pages written by me. If this happens, if you see this in the brain, this has to do with that. So one line after the other, about 1,000 lines. And then once you have this, that the system knows how we are thinking about that, and how we are thinking is written also in our books. For example, in Uribook and the Uribooks, and also in my books. And then we are very happy that we don't need to discover everything ourselves, because there are a lot of very intelligent people around, and they are writing wonderful papers about many things that we are doing, but we can think all this different stuff in once. So the AI stuff gives us the possibility, and we discovered that in 2010, 16 years ago, nobody talked about AI at that time. Even we didn't know that it is AI. It was machine learning stuff, but it's nothing else than AI. And so we saw then that it gives us much more possibilities to think about, but we need, and this is very important, we need that our own system is part of this, of that what we want to understand. And this is also good because now when I'm doing reports, and I often have to do 10 reports in a day, I know that the 10th report is as well written as the first one. Maybe my brain could do the first a little bit better, but after the third report, it becomes pretty difficult to have the concentration. And now we have just to ask the co-pilot take the control of the write for me, and then it writes, and then I always wondering then after, I have to prepare so many things to do it. I have to mark all the significant differences. I don't want that this is done by automatization, because I want to understand myself what is inside in this things, but to sign these deviances, this is done in 2 days. We can learn that. Everybody can learn that in 2 days, and at the end, it's practice, it's feeling, it's and then you can do. Also, what I want to answer to you, Mitch, it's not we don't give the co-pilot the steering from the beginning. He has to follow the rules, and these rules have been given to us from our science, from our experience, from our personal experiences. And this is at the end what makes the difference, to give in something inside a system and say, do it for me. No, it's really controlled learning what we are doing, because we change it very, 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 and we look very thoroughly. And now we have the possibility, if it happened that the co-pilot makes mistakes, we give it in, we correct the whole system, and that makes it's really a learning system behind, and it becomes always better.
Andy,
It's a
thank you
huge
so
work.
much for today. Again, you all will get the recording. I want to bring your attention to the podcast. These webinars are being brought to you for free. And the way we're looking to do that is to integrate everything that NRBS does. So if we can get people to like the podcast, we can get sponsors for the podcast, and then we can continue to bring these. So it's a whole complex cycle, and please give us your support so that we can continue to do it. Thank you so much.
Thanks a lot to everybody.
Thank you, Andy.
Enjoy.
Thank you very much.
Bye.
Bye.